Welcome, future nurses. In today's video, we will be discussing NCLEX-style questions related to oncology. We've carefully selected these questions to reflect real exam patterns and critical thinking situations you'll face as a nurse. So, stay with us till the end. But before we begin the lecture, I want to quickly share a shortcut that has helped thousands of students pass the NCLEX, our complete online NCLEX review crash course. This course was specially designed based on feedback from over 5,000 nurses who successfully passed the NCLEX after enrolling. What will you get in this course? Let me tell you. 100 hours of fast-track animated crash course videos, 300 hours of detailed topic-wise recorded lectures, 5,000 previously asked NCLEX questions, 15 full-length mock tests and practice quizzes, a complete NCLEX prep ebook, 1 year full access, and most importantly, a 99% passing rate. Right now, you can get all of this at a 70% discount. To enroll, just visit our website. The link is in the description box below. Now, let's begin today's video on oncology NCLEX questions. A female client receives an abnormal result on a Papanicolau test. While the nurse is out of the room, she reads her medical chart and later asks the nurse what dysplasia means. Which response best defines dysplasia? The presence of completely undifferentiated tumor cells that do not resemble the original tissue cells. B. An increase in the number of normal cells in a normal arrangement within a tissue or organ. C. The replacement of one type of fully differentiated cell with another type that is not normally found in that tissue. D. Alterations in the size, shape, and organization of differentiated cells. Correct answer. D. Dysplasia refers to changes in the size, shape, and organization of differentiated cells. Option A describes anaplasia, which refers to undifferentiated tumor cells. Option B describes hyperplasia, which is an increase in the number of normal cells. Option C describes metaplasia, which is the replacement of one differentiated cell type with another that is not normally present in that tissue. Let's move on to the next scenario and see what it tests. A female client has been newly diagnosed with cancer. The nurse formulates a nursing diagnosis of anxiety related to the threat of death secondary to a cancer diagnosis. Which expected outcome is most appropriate for this client? A. The client verbalizes feelings of anxiety. B. The client avoids making assumptions about her prognosis. C. The client uses any method to reduce tension. D. The client stops seeking information about her condition. Correct answer. A. The client verbalizes feelings of anxiety. Expressing feelings is the first step in coping with a situational crisis. It also allows the healthcare team to understand the client's emotions and provide appropriate psychosocial support. Option B is inappropriate because suppressing speculation may prevent the client from processing the diagnosis and making necessary plans. Option C is undesirable because not all coping methods are healthy. Some, like alcohol or drug use, could be harmful. Option D is incorrect because seeking information can help the client regain a sense of control and actively participate in decision-making. Let's keep the momentum going with the following question. A male client with a cerebellar brain tumor is admitted to an acute care facility. The nurse formulates a nursing diagnosis of risk for injury. Which, related to, factor best completes this nursing diagnosis statement? A. Related to visual field deficits. B. Related to difficulty swallowing. C. Related to impaired balance. D. Related to psychomotor seizures. Correct answer. C. Related to impaired balance. The cerebellum is responsible for coordination, balance, and motor control. A tumor in this region can cause impaired balance, increasing the risk of falls and injury. Option A refers to visual field deficits, which are more commonly associated with occipital lobe tumors. Option B refers to difficulty swallowing dysphagia, which is more related to brainstem or cranial nerve involvement. Option D refers to psychomotor seizures, which are typically linked to temporal lobe dysfunction rather than cerebellar tumors. Let's keep the momentum going with the following question. A female client with cancer is scheduled to undergo radiation therapy. The nurse understands that radiation can cause certain adverse effects, regardless of the treatment site. Which common side effect should the nurse prepare the client to expect? A hair loss. B. Stomatitis. C. Fatigue. D. Vomiting. Correct answer. C. Fatigue is a common adverse effect of radiation therapy, regardless of the treatment site. Other generalized effects may include skin toxicities and anorexia. Option A. Hair loss is a site-specific effect that occurs when radiation is directed at the scalp. Option B. Stomatitis occurs when radiation is targeted at the head or neck region. Option D. Vomiting is more common when the gastrointestinal area is exposed to radiation. Now let's put your critical thinking to the test with this next scenario. A nurse is teaching a client who suspects she has found a lump in her breast. The nurse explains that a definitive diagnosis of breast cancer is confirmed by A. Breast self-examination. B. Mammography. C. Fine needle aspiration. D. Chest X-ray. Correct answer. C. Fine needle aspiration and biopsy provide cells for histologic examination to confirm a diagnosis of cancer. Option A. Breast self-examination, when done regularly, is a useful method for early detection of lumps, but does not confirm cancer. Option B. Mammography helps detect tumors that may be too small to palpate, but does not provide a definitive diagnosis. Option D. Chest X-rays can help detect rib metastasis, but are not used to confirm breast cancer. Let's move on to the next scenario. A male client undergoes a laryngectomy for the treatment of laryngeal cancer. When teaching the client about neck stoma care, which instruction should the nurse provide? A. Keep the stoma uncovered. B. Keep the stoma dry. C. Have a family member perform stoma care initially until you become comfortable with the procedure. D. Keep the stoma moist. Correct answer. D. The nurse should instruct the client to keep the stoma moist, such as by applying a thin layer of petroleum jelly around the edges, as dryness can cause irritation. Option A is incorrect, because a stoma bib should be used to filter and warm the air before it enters the stoma. Option B is incorrect because keeping the stoma dry can lead to irritation and crust formation. Option C is incorrect because the client should begin performing stoma care independently as soon as possible to promote self-care and confidence. Let's keep the momentum going with the following question. A female client undergoing chemotherapy for breast cancer is being assessed for possible fluid and electrolyte imbalances. Which finding is most indicative of a chemotherapy-induced fluid and electrolyte imbalance? A urine output of 400 milliliters in 10 hours. B. Serum potassium level of 3.7 milliequivalents per liter. C. Blood pressure ranging from 135/60 millimeters of mercury. D. Dry oral mucous membranes and cracked lips. Correct answer. D. Dry oral mucous membranes and cracked lips are signs of fluid loss, which is common due to chemotherapy-induced nausea and vomiting. Option A. A urine output of 400 milliliters in 10 hours is lower than normal, but significant fluid loss would be indicated by urine output below 40 milliliters per hour. Option B. A serum potassium level of 3.7 milliequivalents per liter is within the normal range, so it does not indicate a major imbalance. Option C. A blood pressure of 135/60 millimeters of mercury is slightly elevated systolically, but does not indicate dehydration, as fluid loss typically leads to hypotension. We're moving on to a new case. Stay sharp. A nurse is teaching a group of women how to perform breast self-examinations. What should the nurse emphasize as the primary purpose of performing these self-exams? A. Detecting cancerous lumps. B. Identifying areas of thickness or fullness. C. Noticing any changes from previous self-examinations. D. Recognizing fibrocystic masses. Correct answer. C. The main goal of breast self-examination is to detect any changes in the breast over time. Option A. Only a healthcare provider can diagnose cancerous lumps. Option B. While areas of thickness or fullness may indicate a concern, the key is to notice any new or unusual changes. Option D. Fibrocystic masses are benign and can only be confirmed through medical evaluation. Now, let's put your critical thinking to the test with this next scenario. A 39-year-old client visits the gynecologist for an examination. After the assessment, the physician suspects cervical cancer. The nurse reviews the client's history to identify potential risk factors for this disease. Which of the following findings in the client's history is a known risk factor for cervical cancer? A. Onset of sporadic sexual activity at age 18. B. Spontaneous abortion at age 20. C. Pregnancy complicated by eclampsia at age 25. D. Human papillomavirus infection at age 30. Correct answer, D. Human papillomavirus infection is a major risk factor for cervical cancer. Option A. While early sexual activity, especially before age 16, is a risk factor, sporadic activity beginning at age 18 is not a significant contributor. Option B. A history of spontaneous abortion is not linked to cervical cancer. Option C. Eclampsia during pregnancy is not associated with an increased risk of cervical cancer. Now, let's put your critical thinking to the test with this next scenario. A female client is receiving methotrexate, 10 grams per square meter, intravenously for the treatment of osteogenic carcinoma. To protect normal cells from methotrexate toxicity, the nurse expects the client to receive which additional drug? A probenecid. B. Leucovorin. C. Mercaptopurine. D. Etoposide. Correct answer, B. Leucovorin is administered with methotrexate to protect normal cells from damage that methotrexate could cause if given alone. Option A. Probenecid should be avoided as it reduces renal elimination of methotrexate, increasing the risk of toxicity. Option C. Mercaptopurine is used in leukemia treatment, not as a protective agent for methotrexate. Option D. Etoposide is used for different cancers but does not counteract methotrexate toxicity. Let's move on to the next scenario and see what it tests. The nurse is interviewing a male client about his medical history. Which pre-existing condition would most likely increase the nurse's suspicion of colorectal cancer? A. Duodenal ulcers. B. Hemorrhoids. C. Weight gain. D. Polyps. Correct answer, D. Colorectal polyps are a common precursor to colon cancer. Option A. Duodenal ulcers are not linked to colorectal cancer. Option B. Hemorrhoids do not increase the risk of colorectal cancer. Option C. Unintentional weight loss, not weight gain, is a warning sign of colorectal cancer. Let's tackle another question. A nurse is educating a group of women on early breast cancer detection. The average age of the attendees is 45. According to the American Cancer Society guidelines, which recommendation should the nurse provide? A. Perform a breast self-exam once a year. B. Undergo an annual mammogram. C. Get a hormonal receptor assay annually. D. Have a clinical breast exam by a physician every 2 years. Answer. B. Let us see the rationale. The American Cancer Society recommends that women over the age of 40 have an annual mammogram for early breast cancer detection. Clinical breast exams should be done at least annually, not every 2 years. Breast self-exams should be performed monthly rather than annually. A hormonal receptor assay is performed on existing breast tumors to determine hormone dependency, not as a screening tool. Now let's put your critical thinking to the test with this next scenario. A female client with a persistent cough schedules an appointment after learning that this symptom is among the 7 warning signs of cancer. Which of the following is another warning sign? A. Ongoing nausea. B. Unexplained rash. C. Difficulty swallowing. D. Chronic localized pain. Answer. C. Rationale. Indigestion or difficulty swallowing is one of the 7 warning signs of cancer. The other 6 include changes in bowel or bladder habits, a sore that doesn't heal, unusual bleeding or discharge, a lump or thickening in the breast or elsewhere, an obvious change in a wart or mole, a persistent cough or hoarseness. Nausea is not one of the primary warning signs, and a rash or localized pain is not typically a major cancer indicator. Next up, we have a question that many find tricky. Let's see how you do. A female client has recently been diagnosed with radiation-induced thrombocytopenia. When planning care, which nursing intervention is most appropriate? A. Administer aspirin if the client develops a fever above 101 degrees Fahrenheit. B. Assess the skin for petechiae at least once per shift. C. Encourage frequent rest breaks throughout the day. D. Place the client under strict isolation precautions. Answer B. Rationale. Thrombocytopenia leads to impaired blood clotting, increasing the risk of bleeding. The nurse should regularly inspect the skin for petechiae, purpura, epistaxis, and gum bleeding. Aspirin is contraindicated as it can further impair clotting. Frequent rest periods are necessary for anemia, not thrombocytopenia. Isolation is only required for clients with highly contagious infections, not for thrombocytopenia. Now that we've tackled that one, here comes the next question. A nurse is conducting an educational session on breast cancer awareness at a community health center. According to the American Cancer Society, how often should women receive mammograms? A. Annually after turning 40. B. Every 2 years after the first childbirth. C. Annually beginning after the first menstrual cycle. D. Every 3 years between ages 20 to 40, then yearly afterward. Answer A. Rationale. The American Cancer Society recommends that women begin receiving annual mammograms at age 40. Women aged 20 to 40 should have a clinical breast exam every 3 years, not a mammogram. Getting a mammogram only after childbirth is not a recommended guideline. Let's move on to the next scenario and see what it tests. A nurse is caring for a male patient experiencing severe pain and receiving a continuous IV infusion of morphine. Which nursing intervention is essential? A. Performing a naloxone challenge test before starting therapy. B. Discontinuing the infusion immediately if signs of dependence appear. C. Switching to oral administration if the patient can tolerate fluids. D. Assessing baseline vital signs before the first dose. Answer D. Let us see the rationale. Before administering morphine, the nurse should obtain baseline vital signs, particularly respiratory rate and blood pressure, to monitor for respiratory depression and hypotension. A naloxone challenge test is done before narcotic antagonist therapy, not before opioid administration. Morphine should not be abruptly discontinued due to the risk of withdrawal symptoms. The intravenous route is preferred for severe pain, even if the patient can tolerate oral fluids. Next up, we have a question that many find tricky. Let's see how you do. A 30-year-old woman diagnosed with ovarian cancer has been prescribed hydroxyurea, an antimetabolite drug. The mechanism of action of antimetabolites primarily affects A. Cell division, mitosis, during the M phase of the cell cycle. B. DNA synthesis and replication during the S phase of the cell cycle. C. DNA structure and chemical bonding, cell cycle nonspecific. D. RNA and DNA synthesis at multiple stages, cell cycle nonspecific. Answer B. Rationale. Antimetabolites are S-phase specific and interfere with DNA synthesis, preventing cell replication. This makes them most effective against rapidly dividing cancer cells. Mitotic inhibitors act during the M phase, alkylating agents work across all phases, and some drugs affect RNA and DNA synthesis at multiple stages. Here comes the next question. When using the ABCD method to assess skin lesions for potential cancer, what does A stand for? A. Actinic. B. Asymmetry. C. Arcus. D. Assessment. Answer B. Rationale. The ABCD rule for skin cancer detection stands for A. Asymmetry, uneven shape. B. Border irregularity. C. Color variation. D. Diameter larger than 6 millimeters. Actinic refers to sun-related damage. Arcus relates to an eye condition, and assessment is a general term. Now let's see how you'd handle this next challenge. A male client has been diagnosed with a brain tumor located in the parietal lobe. Which assessment finding is most expected? A. Impaired short-term memory. B. Inability to recognize objects by touch. C. Frequent seizure activity. D. Visual field loss affecting the same side in both eyes. Answer. B. Rationale. The parietal lobe is responsible for sensory processing and spatial awareness. Damage here can cause tactile agnosia, inability to recognize objects by touch. Short-term memory loss is associated with frontal lobe damage. Seizures can occur with tumors in various lobes. Contralateral homonymous hemianopia, visual field loss, is linked to occipital lobe damage. A female client undergoing evaluation for multiple myeloma is undergoing diagnostic testing. Which finding is most indicative of the disease? A. Low serum creatinine levels. B. Decreased calcium levels in the blood. C. Presence of Bence-Jones, protein in urine. D. Reduced serum protein concentration. Answer. C. Let us see the rationale. Bence-Jones. Protein in urine is a hallmark sign of multiple myeloma, though its absence does not rule out the disease. Hypercalcemia, not low calcium, occurs due to bone destruction. Serum protein electrophoresis shows an increased globulin spike, and serum creatinine is often elevated, not decreased, due to kidney involvement. Now let's see how you'd handle this next challenge. A 35-year-old client has been receiving chemotherapy to treat cancer. Which assessment finding suggests that the client has developed stomatitis, inflammation of the mouth? A. White, cottage cheese-like patches on the tongue. B. Yellow tooth discoloration. C. Red, open sores on the oral mucosa. D. Rust-colored sputum. Answer. C. Red, open sores on the oral mucosa. Let us see the rationale. The tissue-destructive effects of chemotherapy can cause stomatitis, leading to red, open sores on the oral mucosa. White, cottage cheese-like patches suggest a fungal infection, candidiasis, which is also a potential side effect of chemotherapy, but not stomatitis. Yellow tooth discoloration is more likely due to antibiotic therapy. Rust-colored sputum is indicative of respiratory conditions like pneumonia, not stomatitis. Ready for the next one? Let's go! During chemotherapy, an oncology client has a nursing diagnosis of impaired oral mucous membrane related to decreased nutrition and immunosuppression, secondary to the cytotoxic effects of chemotherapy. Which nursing intervention is most likely to decrease the pain of stomatitis? A. Recommending that the client discontinue chemotherapy. B. Providing a solution of hydrogen peroxide and water for use as a mouth rinse. C. Monitoring the client's platelet and leukocyte counts. D. Checking regularly for signs and symptoms of stomatitis. Answer. B. Providing a solution of hydrogen peroxide and water for use as a mouth rinse. Let us see the rationale. A hydrogen peroxide and water mouth rinse helps cleanse and soothe oral mucosal irritation caused by chemotherapy. Commercial mouthwashes with alcohol can worsen stomatitis by causing dryness and irritation. Discontinuing chemotherapy is not a practical option, as it does not address the immediate problem. Monitoring platelet and leukocyte counts is important, but does not directly relieve pain. Checking for signs of stomatitis helps with early detection, but does not alleviate discomfort. What should a male client over age 52 do to help ensure early identification of prostate cancer? A. Have a digital rectal examination and prostate-specific antigen test done yearly. B. Have a transrectal ultrasound every 5 years. C. Perform monthly testicular self-examinations, especially after age 50. D. Have a complete blood count and blood urea nitrogen and creatinine levels checked yearly. Answer. A. Have a digital rectal examination and prostate-specific antigen test done yearly. Rationale: prostate cancer incidence increases with age, and early detection is crucial. A digital rectal exam helps identify prostate enlargement or irregularities, while the PSA test detects abnormal prostate activity. A transrectal ultrasound is typically done after abnormal findings on DRE or PSA. Testicular self-examinations check for testicular cancer, not prostate cancer. CBC, BUN, and creatinine tests assess overall health, but do not screen for prostate cancer. Here comes another high-yield NCLEX-style question. A male client complains of sporadic epigastric pain, yellow skin, nausea, vomiting, weight loss, and fatigue. Suspecting gallbladder disease, the physician orders a diagnostic workup, which reveals gallbladder cancer. Which nursing diagnosis may be appropriate for this client? A. Anticipatory grieving. B. Impaired swallowing. C. Disturbed body image. D. Chronic low self-esteem. Answer: A. Anticipatory grieving. Rationale: gallbladder cancer has a poor prognosis, with most clients surviving less than a year after diagnosis. Anticipatory grieving helps the client prepare emotionally for the expected outcome. Impaired swallowing is not a common symptom of gallbladder cancer. Disturbed body image may be relevant for disfiguring surgeries, but gallbladder removal does not typically impact self-image significantly. Chronic low self-esteem is not a primary concern at the time of diagnosis. Now, let's see how you'd handle this next challenge. A male client is in isolation after receiving an internal radioactive implant to treat cancer. 2 hours later, the nurse discovers the implant in the bed linens. What should the nurse do first? A. Stand as far away from the implant as possible and call for help. B. Pick up the implant with a long-handled forceps and place it in a lead-lined container. C. Leave the room and notify the radiation therapy department immediately. D. Put the implant back in place using forceps and a shield for self-protection and call for help. Answer: B. Pick up the implant with long-handled forceps and place it in a lead-lined container. Rationale: handling radioactive implants requires caution to minimize exposure. The correct action is to use long-handled forceps to place the implant in a lead-lined container, then notify the radiation therapy department. Standing away and calling for help delays safe containment. Leaving the room without securing the implant increases radiation exposure risks. Replacing the implant is unsafe and should only be done by a radiation specialist. Time to test your knowledge with the next clinical decision. Jevina, with advanced breast cancer, is prescribed tamoxifen, Nolvadex. When teaching the client about this drug, the nurse should emphasize the importance of reporting which adverse reaction immediately. A. Vision changes. B. Hearing loss. C. Headache. D. Anorexia. Answer: A. Vision changes. Rationale: tamoxifen, an estrogen receptor blocker, can cause irreversible ocular toxicity. Any vision changes should be reported immediately. Hearing loss is not a known adverse effect of tamoxifen. While headache and anorexia are possible side effects, they are not as critical as vision changes and do not require immediate discontinuation of therapy. Here comes another high-yield NCLEX-style question. A female client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites for cancer cells? A. Liver. B. Colon. C. Reproductive tract. D. White blood cells. WBCs. Answer: A. Liver. Rationale: the liver is a common site for metastasis due to its rich blood supply and role in filtering blood. Many cancers, including those of the GI tract, breast, and pancreas, commonly metastasize there. The colon and reproductive tract are primary sites of some cancers, but are not frequent metastasis sites. WBCs are not a common location for metastasis, though hematologic cancers affect them. Time to test your knowledge with the next clinical decision. Nurse Brian is developing a plan of care for marrow suppression, the major dose-limiting adverse reaction to floxuridine, FUDR. How long after drug administration does bone marrow suppression become noticeable? A 24 hours. B. 2 to 4 days. C. 7 to 14 days. D. 21 to 28 days. Answer: C. 7 to 14 days. Rationale: bone marrow suppression typically appears 7 to 14 days after administration due to the delayed depletion of bone marrow stem cells. It does not usually present within 24 hours or 2 to 4 days. The suppression is evident before 21 to 28 days. Now, let's see how you'd handle this next challenge. The nurse is preparing a female client for MRI to confirm or rule out a spinal cord lesion. Which of the following would pose a threat during the MRI? A. The client lies still. B. The client asks questions. C. The client hears thumping sounds. D. The client wears a watch and wedding band. Answer: D. The client wears a watch and wedding band. Rationale: metal objects pose a safety risk during MRI scans due to the strong magnetic field. Lying still is necessary for accurate imaging. Asking questions does not pose a risk, and hearing thumping sounds is normal. Which statement about breast cancer is correct? A. Men cannot develop breast cancer. B. Mammography is the most reliable method for detecting breast cancer. C. Breast cancer causes the highest number of cancer-related deaths in women. D. A mastectomy may not be required for small, early-stage tumors. Answer: D. Rationale: a mastectomy is not always necessary for small, localized, early-stage tumors. Men can develop breast cancer, although it is rare. Monthly breast self-examinations are crucial for early detection, but mammography is more effective for confirming findings. Lung cancer, not breast cancer, causes the most cancer-related deaths in women. Let's tackle another question. When is the best time for a premenopausal woman to perform a breast self-examination, BSE? A. On the first day of the menstrual cycle. B. On the last day of the menstrual cycle. C. Any day of the month. D. A few days after menstruation ends. Answer: D. Rationale: premenopausal women should perform BSE after their menstrual period, when breast tissue is least tender and lumpy. The first and last days of the cycle are not ideal, as hormonal changes can cause swelling and sensitivity. Postmenopausal women should choose a consistent date each month for BSE. Let's tackle another question. A client asks why testicular self-examination is important. What is the best response? A. It helps detect testicular cancer early, increasing the chances of a cure. B. Testicular cancer has the highest mortality rate among men. C. Testicular cancer primarily affects older men. D. Testicular self-examinations are only necessary if symptoms are present. Answer: A. Rationale: testicular cancer is highly curable if detected early, making self-examinations crucial. It is more common in younger men, not older men. Lung cancer, not testicular cancer, has the highest mortality rate among men. Waiting for symptoms to appear may delay diagnosis and treatment. Let's tackle another question. A client receiving chlorambucil chemotherapy is concerned about hair loss. When does chemotherapy-induced alopecia typically occur? A. Immediately after the first dose. B. Within the first week of treatment. C. 2 to 3 weeks after therapy begins. D. After completing chemotherapy. Answer: C. Rationale: alopecia, hair loss, from chlorambucil usually begins 2 to 3 weeks after starting treatment. It does not happen immediately or after the first dose. Hair regrowth may begin after chemotherapy is completed. Let's tackle another question. Thiotepa is an alkylating agent used in cancer treatment. How does it work? A. By destroying the cancer cell membrane. B. By stimulating cancer cell apoptosis. C. By interfering with DNA replication and RNA transcription. D. By preventing angiogenesis in tumors. Answer: C. Rationale: Thiotepa disrupts DNA replication and RNA transcription, preventing cancer cells from multiplying. It does not destroy the cell membrane, stimulate programmed cell death, apoptosis, or directly prevent blood vessel formation, angiogenesis. Here comes another high-yield NCLEX-style question. A client is learning how to perform a testicular self-examination, TSE. Which statement indicates correct understanding? A. I should perform TSE once a year. B. I should check my testicles while lying down. C. I should perform TSE after a warm bath or shower. D. I should squeeze my testicles firmly to check for lumps. Answer. C. Rationale. TSE should be done monthly after a warm bath or shower when the scrotum is relaxed. The examination should be performed standing up, using both hands to gently roll each testicle. Squeezing too hard can cause discomfort and is unnecessary for detection. Now let's see how you'd handle this next challenge. A client receiving chemotherapy develops thrombocytopenia. Which nursing intervention is the highest priority? A. Monitoring for signs of infection. B. Encouraging ambulation to prevent deep vein thrombosis. C. Assessing for signs of bleeding. D. Providing emotional support for fatigue. Answer. C. Rationale. Thrombocytopenia, low platelet count, increases the risk of bleeding. Monitoring for petechiae, bruising, and signs of internal bleeding is essential. Infection monitoring is important for leukopenia, and ambulation is more relevant for preventing deep vein thrombosis, DVT. Fatigue management is supportive, but not the top priority. Let's see another question. A client asks when to perform a breast self-examination, BSE. What is the correct response? A weekly for best results. B. During ovulation when hormone levels are high. C. On the first day of the menstrual cycle. D. 7 days after menstruation begins. Answer. D. Rationale. The best time for BSE is 7 days after menstruation starts, when hormone-related breast changes have subsided. Performing it weekly is unnecessary and may lead to anxiety. Ovulation and the onset of menstruation cause breast tenderness and changes that can make the examination less reliable. Let's tackle another question. After a major surgery, a client is at risk for deep vein thrombosis, DVT. Which intervention is most appropriate? A. Encouraging range of motion exercises. B. Using a knee gauge when positioning the client. C. Encouraging bed rest for 24 hours, post-surgery. D. Avoiding compression stockings to prevent pressure on the legs. Answer. A. Rationale. Range of motion exercises help prevent DVT by promoting blood circulation. The knee gauge, elevating the knee in bed, should be avoided as it can impair venous return. Early ambulation and anti-embolism stockings are beneficial for preventing thrombophlebitis. Prolonged bed rest increases the risk of clot formation. Here comes another high-yield NCLEX-style question. A client is scheduled for a pelvic ultrasound. Which instruction is correct? A. Do not eat or drink anything for 6 hours before the procedure. B. Avoid drinking fluids for 2 hours before the test. C. You may be given a mild sedative before the procedure. D. Drink plenty of water before the test to keep your bladder full. Answer. D. Rationale. A full bladder is necessary for a pelvic ultrasound to improve visualization of the pelvic structures. Clients are instructed to drink large amounts of water before the procedure. Fasting is required for an abdominal ultrasound, not a pelvic ultrasound. Sedation is not necessary for this test. Let's tackle another question. A nurse is evaluating a patient for a suspected tumor. Which diagnostic test is most definitive in determining whether the tumor is malignant or benign? A biopsy. B. Magnetic resonance imaging. C. Computed tomography scan. D. Ultrasound. Answer. A. Rationale. A biopsy is the gold standard for diagnosing malignancy by allowing microscopic examination of tissue samples. While MRI, CT scans, and ultrasound can detect the presence and location of a mass, they cannot confirm malignancy. Only a biopsy can. Multiple myeloma is characterized by which pathological finding? A. Overproduction of immature lymphocytes. B. Increased production of platelets. C. Excessive proliferation of myeloblasts. D. Abnormal proliferation of plasma cells in the bone marrow. Answer: D. Rationale. Multiple myeloma is a B-cell malignancy in which abnormal plasma cells accumulate in the bone marrow, leading to impaired immunity and bone destruction. Options: A and B do not relate to multiple myeloma. Option C describes leukemia, not multiple myeloma. Let's tackle another question. A nurse is reviewing lab findings of a patient with multiple myeloma. Which result is most characteristic of this disease? A. Elevated white blood cell, WBC count. B. Decreased blood urea nitrogen, BUN level. C. Increased plasma cells in the bone marrow. D. Hypocalcemia. Answer: C. Rationale. Multiple myeloma causes an abnormal increase in plasma cells in the bone marrow. Additional findings include anemia, hypercalcemia from bone destruction, and elevated BUN due to kidney impairment. An increased WBC count may occur, but is not a hallmark sign of multiple myeloma. Here comes another high-yield NCLEX-style question. A nurse is assessing a patient for possible testicular cancer. Which finding is not typically associated with this condition? A. Alopecia. B. Painless testicular lump. C. Testicular heaviness. D. Lower back pain. Answer: A. Rationale. Alopecia, hair loss, is not a sign of testicular cancer, but may occur due to chemotherapy. Testicular cancer signs include a painless lump, heaviness in the scrotum, and lower back pain, which can indicate metastasis to retroperitoneal lymph nodes. Now let's see how you'd handle this next challenge. A patient receiving radiation therapy to the larynx is most likely to experience which side effect? A. Diarrhea. B. Nausea and vomiting. C. Sore throat. D. Dyspnea. Answer: C. Rationale. Radiation side effects depend on the treatment site. For laryngeal radiation, a sore throat is expected. Nausea, vomiting, and diarrhea are more common with gastrointestinal radiation, while dyspnea is associated with lung radiation therapy. A nurse is caring for a patient with an internal radiation implant. Which action is most appropriate? A. Allow children under 16 years to visit briefly. B. Limit time spent in the patient's room to 30 minutes per 8-hour shift. C. Stay in the room as much as possible to monitor the patient. D. Remove the dosimeter badge when leaving the room. Answer: B. Rationale. Exposure to radiation must be minimized. The nurse should limit exposure to 30 minutes per shift, wear a dosimeter badge, and prevent children and pregnant women from visiting. Here comes another high-yield NCLEX-style question. A client with a cervical radiation implant should be positioned in which way? A bed rest in the dorsal position with minimal movement. B. High Fowler's position for lung expansion. C. Side-lying position for comfort. D. Prone position to reduce pressure on the abdomen. Answer: A. Rationale. To prevent displacement of the cervical radiation implant, the client should be kept on bed rest in the dorsal position. The head of the bed may be slightly elevated, 10 to 15 degrees, for comfort. Turning should be avoided, but if necessary, log rolling should be used. A nurse is preparing a room for a patient receiving internal radiation therapy. Which essential item should always be available? A radiation shield for the entire room. B. Extra dosimeter badges for staff. C. Portable lead apron for visitors. D. Lead container and long-handled forceps. Answer: D. Rationale. If the radiation implant becomes dislodged, the nurse should use long-handled forceps to place it in a lead container for safe removal. The other options are not required for managing internal radiation exposure. Let's tackle another question. A neutropenic patient is at high risk for infection. Which intervention is most appropriate? A. Restrict all visitors. B. Avoid encouraging oral fluid intake. C. Perform meticulous hand hygiene before and after contact. D. Insert an indwelling urinary catheter to monitor urine output. Answer. C. Rationale. Hand hygiene is the most important infection control measure. Not all visitors are restricted, but individuals with infections should be avoided. Fluids should be encouraged to prevent dehydration. Invasive procedures, like catheters, should be avoided unless absolutely necessary. Let's tackle another question. When assessing a patient's pain level, which method is most reliable? A nurse's observation of nonverbal pain cues. B. The client's self-report of pain. C. The client's response to pain medications. D. The nurse's assessment of facial expressions and body language. Answer. B. Rationale. The client's self-report is the gold standard for assessing pain. Nonverbal cues and medication response provide additional information, but pain is subjective and best evaluated through direct communication with the patient. Here comes another high-yield NCLEX-style question. A nurse is assessing a client with suspected Hodgkin's disease. Which clinical manifestation is most characteristic of this condition? A. Chronic fatigue and weakness. B. Frequent urinary tract infections. C. Sudden onset of high fever. D. Painless enlargement of lymph nodes with weight loss. Answer. D. Rationale. Hodgkin's disease is a chronic progressive neoplastic disorder of lymphoid tissue. It is characterized by painless lymph node enlargement, often in the cervical, axillary, or inguinal regions, with possible spread to the spleen and liver. Weight loss is a common systemic symptom. Fatigue and weakness may occur, but are not primary manifestations. Let's tackle another question. A nurse is reviewing a client's history and notes symptoms of abdominal distension, urinary urgency, and pleural effusion. These findings are most suggestive of which condition? A. Endometrial cancer. B. Breast cancer. C. Cervical cancer. D. Ovarian cancer. Answer. D. Rationale. Ovarian cancer often presents with abdominal distension, urinary urgency, frequency, malnutrition, ascites with dyspnea, constipation, and pain due to tumor pressure. Uterine cancer, endometrial cancer, is more likely associated with abnormal uterine bleeding, hypermenorrhea. Now, let's see how you'd handle this next challenge. A nurse is providing discharge instructions to a client who has undergone a conization procedure for cervical dysplasia. Which complication should the nurse monitor for? A. Ovarian perforation. B. Renal dysfunction. C. Deep vein thrombosis. D. Hemorrhage and cervical stenosis. Answer. D. Rationale. Conization involves removing a cone-shaped area of the cervix and is commonly used to diagnose and treat precancerous lesions. Complications include hemorrhage, infection, and cervical stenosis, narrowing of the cervical canal. Ovarian perforation is not a known complication of this procedure. Let's tackle another question. Tumors that originate from bone, muscle, and other connective tissues are classified as A. Carcinomas, B. Lymphomas, C. Leukemias, D. Sarcomas. Answer. D. Rationale. Sarcomas are malignant tumors that arise from connective tissues, including bone, osteosarcoma, muscle, fat, blood vessels, and cartilage. Carcinomas originate from epithelial cells, lymphomas affect the lymphatic system, and leukemias affect the blood and bone marrow. Here comes another high-yield NCLEX-style question. A nurse is caring for a client who has recently been diagnosed with terminal cancer. The client says, "If I just follow my treatment exactly, maybe I can beat this." The nurse recognizes this statement as which stage of grief? A. Denial. B. Depression. C. Bargaining. D. Anger. Answer. C. Rationale. Bargaining is a stage of grief in which a person tries to negotiate or make deals to change their fate. It often involves making promises or commitments in exchange for more time. Denial is characterized by shock and disbelief. Depression manifests as hopelessness, withdrawal, or sadness. Anger involves blaming others or asking, "Why me?" Let's tackle another question. A nurse is assessing a client who had a mastectomy several months ago. Which finding indicates a potential complication? A mild tenderness near the surgical site. B. Arm edema on the operative side. C. Numbness near the incision site. D. A small amount of serous drainage. Answer: B. Rationale. Lymphedema, or arm edema on the operative side, is a potential complication following a mastectomy. It results from impaired lymphatic drainage due to lymph node removal. It can occur immediately after surgery, or even months or years later. Mild tenderness and numbness are expected post-op findings. A small amount of serous drainage is normal during the healing process. Let's tackle another question. Which of the following is the most common risk factor for developing laryngeal cancer? A long-term use of NSAIDs. B. Cigarette smoking. C. Low dietary vitamin C intake. D. Frequent upper respiratory infections. Answer: B. Rationale. Cigarette smoking is the primary risk factor for laryngeal cancer. Heavy alcohol consumption and exposure to environmental pollutants further increase the risk. NSAIDs, vitamin C intake, and upper respiratory infections are not major risk factors for laryngeal cancer. Let's tackle another question. A client is diagnosed with a vesicovaginal fistula. Which symptom would the nurse expect? A. Pain during urination. B. Urine leakage from the vagina. C. Blood-tinged vaginal discharge. D. Severe lower abdominal cramping. Answer: B. Rationale. A vesicovaginal fistula is an abnormal connection between the bladder and vagina, leading to continuous leakage of urine into the vaginal canal. This results in incontinence and irritation. Other options do not specifically indicate a vesicovaginal fistula. Now, let's see how you'd handle this next challenge. A client undergoing chemotherapy is prescribed allopurinol. What is the primary purpose of this medication? A. Prevent chemotherapy-induced nausea. B. Reduce the risk of alopecia. C. Increase white blood cell production. D. Prevent hyperuricemia. Answer: D. Rationale. Allopurinol decreases uric acid production and helps prevent hyperuricemia, which occurs due to the massive cell destruction during chemotherapy. It is not used to prevent nausea, alopecia, or bone marrow suppression. Great job staying till the end. We hope you learned a lot from these oncology-related NCLEX questions. If you found this helpful, imagine what our full NCLEX crash course can do for you. Don't miss the chance to join thousands of successful nurses. Enroll now using the link in the description. Thank you for watching, and as always, keep learning, keep practicing, and keep pushing forward. You've got this, nurse.